Once your surgery is done, your focus will be on healing. If you follow the recommendations listed in this section, you should have a smooth recovery after surgery. When you first get home, you will become your main caregiver. Don't worry, you'll do a great job, and help is just a click or a phone call away. Here are the most important things to keep in mind. Continue to use your crutches as instructed. If you received a femoral block, you will start to get feeling back in your leg the morning after your surgery, but you'll have difficulty controlling your leg as the quadricep muscles are paralyzed until the block completely wears off. Wear your brace at all times or as instructed by your surgeon. Our staff will arrange for you to see a physical therapist 2 to 3 times a week when your surgery is booked, before you leave the hospital or at your first postoperative visit. Do not swim, use hot tubs, or bathe in a tub until your surgeon gives you the go-ahead. Do not use ointments, lotions, oils, or vitamin preparations on your incision until after your first follow-up appointment. Use the cooling system ice pack on your knee for 20 minutes, 6 to 8 times daily to decrease pain and swelling. Be sure to take your pain medication with food to avoid nausea. To help your wound heal faster, continue your healthy eating habits. Give up smoking if you haven't already. And if you're a diabetic, maintain control over your blood glucose level. Do not allow pets to share the space where you're sleeping and resting. They can infect your incision. To reduce the chance of getting an infection, make sure you and those around you wash their hands thoroughly when they are visibly soiled, before and after care of your incision, before eating, after going to the bathroom, and after handling pets. You can shower when you get home from the hospital, but be very careful to follow these instructions. Your surgeon will want you to cover your brace with a bag anytime you shower until your leg is completely healed. We'll give you a shower bag at your first postoperative visit. This bag will help keep your leg dry until you're allowed to get your incision wet at 10 to 14 days after your surgery. It's safest to sit while taking a shower. Remember, do all you can do to keep your incision dry, but if it does become wet, gently pat it with a clean towel. Follow the instructions that your nurse gives you at your first postoperative visit. Our goal is to get you full range of motion in 4 to 6 weeks. You may experience shin pain and bruising down your shin. This is normal. If you have questions or concerns about how long you see or feel this happening, or about the severity of the pain, please call our nurse at 603-650-7788. Your narcotic pain medications might include either oxycodone, hydrocodone, or Vicodin, or OxyContin, the sustained release form of oxycodone. Sometimes your surgeon may have you take non-steroidal anti-inflammatory medication, such as ibuprofen or naproxen. Do not take these types of medicines if they've not been prescribed for you until you discuss it with your surgeon at your follow-up visit. Some patients have expressed concern about becoming addicted to pain medications after ACL surgery. The medications you're prescribed should not cause narcotic addiction. You will only be using them for a short time to relieve surgical pain. However, if you have concerns about addiction, please discuss this with either your surgeon or your primary care physician. Many patients find that taking narcotic medications as directed helps to control their pain. Be sure to always take your pain medication with food to help avoid nausea. No pain, no gain is not our philosophy. Tolerable discomfort is our goal, whether during exercise, daily activities, or at rest. Be aware that pain medications can cause constipation. Drink plenty of fluids and eat lots of fruits, vegetables, and foods high in fiber, such as whole grains and cereals, to avoid constipation. Keep track of how much pain medication you have. It's very important to call the clinic 3 to 4 days before you run out of your medication to give the clinic time to contact the pharmacy. Calling ahead is necessary because prescriptions for narcotic pain medications must be mailed to you or your pharmacy. By law, you cannot call into the pharmacy for them. Narcotics and weak muscles may make it unsafe for you to drive. You should not drive when you're taking narcotics or if your surgeon has restricted weight bearing in your leg. Typically, ACL patients can get back to driving within 3 to 4 weeks after surgery. Your first checkup will happen 1 to 3 days after your surgery. The exact time and date of your appointment will be noted on your discharge summary sheet. This appointment will be with a provider on the sports medicine team and also with a physical therapist if possible. We urge you to contact us if you experience any of the following conditions: unusual calf pain, redness or swelling, if you have a fever where your temperature is above 100.3 degrees for more than 24 hours. Note that mild temperature elevations are normal in the afternoons and evenings. If you have increasing redness, swelling, warmth, unpleasant odor, or milky liquid coming from the incision. If you notice increasing knee pain, either walking or at rest. If you have sudden shortness of breath or chest pain, you should call 911. If you have trouble reestablishing normal bowel habits despite the use of stool softeners and increased fluids, you should call and let the team know. And if you have any other symptoms you're concerned about, please feel free to call the clinic to discuss them. Even for the most determined and disciplined patient, recovery might not happen as quickly as you'd like. You may feel frustrated even at 6 to 8 weeks after surgery. You might think you're going a bit stir-crazy. You will get better. Healing takes time, so be patient with yourself. It's normal to have an emotional slump about 3 weeks after surgery. This slump will pass, but feel free to call your surgeon's nurse for a little support. A little reassurance may be just what you need. Many patients find they still become tired very easily, or are tired most of the time. Some patients find this is true for up to several months after surgery. These feelings are a normal part of your body's recovery and the healing that you have to do. Over time, as you are able to move more and have less pain, you may find that you are more tired instead of less. Some surgeons will restrict the amount of weight you put on your surgical leg for a period of time after your surgery. Please refer to your discharge summary for your surgeon's advice. It's important that you follow your doctor's and physical therapist's instructions. The majority of ACL patients are allowed weight bearing as tolerated with crutches. Your specific weight-bearing precautions are in effect until at least 10 to 14 days after your surgery. If you also had another procedure done at the same time, such as a meniscal repair, your weight-bearing may be restricted for up to 6 weeks. A limp is normal and is usually due to muscle weakness. Follow your exercise program and you will improve over time. Understand that your progress will be gradual. Please remember that it takes many months to fully heal, so try to be patient. You will continue to see improvements even after 12 months. It's normal to feel some numbness near the incision on the front of your knee. Our team will schedule regular follow-up visits each time you come to see us. You can expect to come back for follow-up visits at these intervals: 1 to 3 days, 2 to 3 weeks, 10 to 12 weeks, 6 months, and 9 to 12 months. These appointments may be with your surgeon or one of our associate providers, such as a physician assistant or a nurse practitioner. These associate providers know your medical history and individual situation as well as your surgeon, so you should be confident they'll provide you with excellent care.